Will there come a day when more children are not vaccinated? And if they do choose, and if you do choose to vaccinate your child, are you in danger from those who are not immunized?
Well, those are the questions that parents think about at the start of every new school year, especially as more and more parents are opting out of vaccinations. 13's Health Check's Christy Myers joining us now with more on this. Is always a controversial issue at the start of every school year. Christy.
It is controversial, Melanie, but as you pointed out, the opt-out policy is legal if you follow the guidelines required by the state of Texas. But it's controversial because someone else's decision to opt their child out might affect your newborn baby when you come into contact with them at the grocery store. Alma Anchondo makes it a point to keep her daughter's vaccinations up to date, and she's surprised that some parents opt out of the required school shots.
I think it's not okay for other kids to go at school without shots.
In the 2012-2013 school year, the CDC found that the parents of 7,000 Texas kindergarten children opted out of their vaccinations, and that worries public health officials here in Houston.
But today's parents haven't seen those epidemics, and they don't know the risk that they're putting their child at by not vaccinating them.
Dr. Troisi says the children at risk are not only the ones who aren't vaccinated, but babies who are too young to get their shots and children with cancer and AIDS who can't get vaccines for medical reasons.
It's estimated that for every person who has measles, that person infects another 12 to 15 people.
She says parents opt out because they worry about a young child getting so many vaccines at the same time.
Understand when parents are afraid because, they're trying to do the best thing for their kids, so are we. And there's a lot of really scary stuff out there on the internet and a lot of misinformation.
Much of that misinformation involves claims made by a British doctor who has since lost his license that the measles vaccine can cause autism. The claim has been refuted, but it's contributed to a 1% opt-out rate for philosophical reasons in Texas last year.
Some areas, like I think Colorado, has a much higher rate of people that don't immunize for philosophical objections, and they do have more outbreaks.
I don't think anybody wants to go back to a 1940s, 1930s world where so many children died of these diseases.
For families who opt out, the CDC says it is important to tell your pediatrician and any other medical people that may take care of him if there is an outbreak of a vaccine-preventable disease in your area. The CDC says parents should be prepared to keep their children at home until the school says it's safe for them to return. And finally, the CDC recommends these parents be especially careful when traveling so the unvaccinated child isn't exposed to and doesn't expose others to vaccine-preventable diseases. So it gets pretty complicated here for parents to make the choice. We talked about very few people, about 7,000 parents, kindergartners last year made this choice, but doctors are very concerned.
Yeah, and shocking numbers when you're talking about one child with the measles infecting that many others around them.
12 to 15, and we really even didn't talk about that some vaccines do wear off, and measles is one that you need a booster. So you don't want to have a child with a fresh case of measles next to your child who might be just about ready to get the booster shot. You never know at what state your vaccines are, so the more people that are vaccinated, the safer it is for everybody.
Well, and it's a reminder when your pediatrician tells you to keep that baby at home for 6 or 8 weeks when they're newborn, it's probably a good idea.
It is.
Yeah. Okay.
All right, Christy, thanks so much.